Hi, the Dr. Lee again. Today I would like to discuss something about cold or and influenza. And I have so many patients ask me about common cold and flu symptoms, and when do they need to see a doctor, or when they don't need to see the doctor. Um, and so tonight I will go over the common cold and also influenza briefly. Influenza, or we call it flu, and common colds are both respiratory illness, and they caused by different type of virus. These two type of illness they actually have similar presentation of flu-like symptoms, but the common cold will be on a mild form. Influenza will be a little more sicker and also most of the time have a high fever. And in general, the flu symptom come on very sudden, and common cold a little more slowly. The common cold most of the time will last for less than a week or two, and they recover very easily. The influenza will last much longer, sometimes up to a few months, and people still don't feel well. And influenza is very contagious respiratory illness, and it actually spread through air and droplets. Common cold basically kind of like self-limited. It means like it get better easier on its own. So today I'm concentrate about the influenza of flu. So again, what about the flu symptoms and what is the severity of the flu symptoms here? Now the flu symptoms are somewhat different from a cold, as I mentioned earlier. The flu usually comes on suddenly with a high fever, and the symptoms more severe than common cold. Um, so most of the time the patient will have fever and feel chills, and the temperature could be as high as 103 degrees Fahrenheit. They will have coughed, mostly non-productive coughing, sore throat, and also running or stuffy nose, um, muscle or body pain, including joint pain all over the entire body, headache, and feeling tired and fatigued all in a sudden. And some people may have vomiting and diarrhea, but those symptoms are more common in children rather than in adults. And common colds are again usually milder than flu symptoms. And most people with common cold, mostly they have running nose and stuffy nose, and the fever much milder, or actually might have low grade or even have no fever. But in some case of flu symptoms or in mild form of flu symptoms, some patients do not have fever either, but they still have the symptoms of cold, sore throat, also headache and pain. So if you're not quite sure, and if your symptom not getting better in a week, it's better for you to see a doctor and to find out what actually you have. Now, types of influenza virus. How many types of influenza out there? Actually, there's a three types, but we always know the most common two: influenza A and influenza B. There's also influenza C. Influenza A and B cause mostly the illness or seasonal epidemic, and mostly in the nationwide or actually in United States, influenza A and B are very common during the winter time. Influenza type C, which is more milder, but it is self-limited as well. It's also a very mild respiratory illness. Um, the influenza C doesn't cause any big problem, so we actually don't do anything about influenza C. And in your flu vaccine, mostly they only protect you against influenza A or influenza B, but not covering the influenza C. Okay, if you still remember, in 2009 we have an outbreak of influenza by the swine flu, which is a different type of influenza A. They actually changed the strain, and it was called H1N1, if you still remember it. And so virus, they change the strains every year, so that's why every year you different type of vaccine. And also that's why you had to get your vaccine every year, because the strains may change year from year. And so what are the flu complications? Now, if the flu symptom getting worse and do not get better, or particularly when you have flu symptom to begin with, and after a week you feel better, and then a week later and the fever come back, and then you're prone to complications. Now, those complications actually including pneumonia, bronchitis, sinus or ear infection. That means the influenza will lead you into virus infection and also bacterial infections. Actually, the influenza or the flu will make the chronic health problem even worse. For example, the people with asthma will give them asthmatic attacks. If they have a chronic congestive heart failure or heart disease, actually, the influenza will make the symptom worse and make the heart people or the one with heart failure and into a worse heart failure and during the influenza infection. There's also people at risk for influenza. Basically, anyone can get flu symptoms or can be infected. Again, it depends on your health status, and most serious problem from influenza can happen at any time and any age. Those people are susceptible to the complications. Actually, are those people older than 65 years old, and those people with cancer, immunocompromised, and or heart disease or diabetic with lung disease, and those are actually higher risk for influenza infection, and also including those healthy people working in the medical field, they're also high risk for the influenza infection. Pregnant women or young children are also likely to get complications from the influenza infection. So how severe the influenza can get to, and how it happen, or how can it get into a big epidemic. Now all this depends on the vaccination, and it also depends which type of influenza or flu virus spreading out, and how much of flu vaccine available, and actually when the vaccine available, if it comes on early and more people get vaccinated earlier, can actually cut down the infection rate. And also how many people get vaccinated. If we have more people get vaccinated, that means the infection rate will actually cut down too. And the other factor determine how severe the vaccine or how severe the influenza will be, and also determine how well the flu vaccine is matched to the flu virus that are causing the illness during that particular year. Now, from the CDC data, over a period of 31 seasons between 1976 to 2007, it's estimated the flu-associated death or people they die from flu-related disease at a low level of about 3,000 to a high level of 49,000 people every year. Now, during a regular flu season, about 90% of those flu-related deaths actually occur in people 65 or older. And if we go back to the year 2009 to 2010, and we have a different strain, remember the swan flu or H1N1, it caused a flu pandemic. In United States alone at that year, we actually have 12,000 deaths. 90% of those diseased patients actually occur among people younger than 65 years old, and mostly between 50 to 65. And about 80% of these diseased patients, they actually having one or more underlying chronic medical condition or medical illness. So if you could keep yourself healthier, your complication rate will be actually lesser. And now, how to prevent the flu? First of all, you better to get a flu vaccine if you don't have any reaction. And I have patients have a flu vaccine reaction, such as getting a flu symptom after getting flu. I recommend the patient to get a half shot to both arms, half shot on the left, half shot on the right arm, and actually this will reduce the side effect from the flu vaccine. So again, if you had a reaction to a flu vaccine in the past, you can try this. Ask your physician give you a flu vaccine, half dose on the left arm, half dose to the right arm, and to see how it does to you. And so the first step to prevent the flu or is to vaccinate yourself and to get the vaccine as early as possible. And those people who are at risk for disease or those people who are older than 65 years old or have chronic medical illness, or children should get vaccinated, or even pregnant women. Again, you need to check with your physicians. Now, the vaccination is important to decrease the risk of severe flu illness, but it doesn't mean that you will not get the flu after you get a flu shot. Again, the vaccination is protect you from getting the serious ill effect from the influenza infection. Okay, now, so how can you prevent the flu spread out? And first of all, when you cough or sneeze, try to cover your nose and on your mouth with a tissue paper, and then toss it away into the garbage bin. And avoid touching your eyes or nose constantly with your hand, because this is the way to get yourself infected. If someone is sick, try to avoid contact with them, or keep them at the distance by 3 feet minimum, and this will actually reduce the transmit of the infection. And if you are sick with the influenza or flu-like symptoms, the CDC recommend you stay home. So when you can go back to work, actually you have to wait until your fever completely gone for at least 24 hours. We mean the fever gone without any fever reducing medications, and then you should be able to return to work or to school. And if you are sick, try to limit your contact with any people, particularly those that are elderly. And always try to use a good hand wash technique. Wash your hand with soap and water. If you don't have soap and water available, you can use the alcohol to wipe your hand, or you could use the hand sanitizer. This is pretty cute. The hand sanitizer, and which also will help you to reduce the chance of spread of the germ. So use it more frequently when you need them. So how do we diagnose influenza or flu symptoms? Basically, you go by your symptoms, but sometimes you're really serious or very ill, we actually will do some swab, full swab test to test whether you have influenza or not, and then we give you treatment. And again, you need to go to the doctor to get the test. For treatment wise, here we have medicines and we have antivirus medications. Basically, those medicines are prescribed and not over the counter, and you have to go to see a doctor and they give you the medications. And those medications is recommended to be used within the first 2 days of the symptoms occurred. From my experience, for those patients if they're at high risk for complication, or they are really older than 65 years old, or they actually really ill and sick and they didn't get better within 2 weeks after the initial infection, I still treat them with the medications. And so one of those medications, if you're interested to note, and here are the medications. In United States, we have 4 licensed prescriptions available. I don't know, can you see it? It's called amantadine, and the other one is the amantadine, and the other one is rimantadine, and also Vanessa, and also Tamiflu. The first 2, amantadine and rimantadine, we basically don't use it because a lot of resistance to these 2 medicines, and they're only good for influenza A and have no effect on influenza B. And the second group, the one with the Tamiflu and also the Vanessa, they're the 2 common antivirus medication that we use in United States for the influenza infection. And the effect is to block the enzyme produced by the virus to infect the body cells. So again, those 2 medications, the effect is to block the enzyme produced by the virus. Those are the 2 common ones that we use in United States and actually nationwide. So besides prescribed medication, anything else? Yeah, you can do some supplement, like take some vitamin C, zinc. Make sure you have enough sleep for at least 8 hours, and also drink enough liquid and keep yourself healthy. Again, the main key to keep yourself healthy, and then you stay away from the cold and influenza, and wash your hands more often. And I hope you learned something about today's session, and I see you next time. Good night.